Anyways, I am Dr. Nicole Klersy-Mohr here at Perfect Touch Massage and Chiropractic. I'm going to be going through chiropractic care, what it is, what it isn't, different forms, why it's important, all that stuff. So sit back and relax, or grab your pen and paper, take notes, go online and schedule with us. You know, you might need an adjustment today. Anyways, let's dive on in. We have a lot to go over, so I just wanted to say hi and thank you for watching. I know you could be watching many other things, but maybe you're watching me to hear me screw up on my recording here. Yes, this one is pre-recorded. I have to figure out all my technology, so I think I record all of them and put them on, but soon, maybe, I will go live. So anybody who's tech savvy out there and wants to reach out and do something fun for somebody for free, I would love that. Or to work together, because we can only do what we're good at, correct? All right, so did you know basically that our goal today is to bridge the gap between traditional healthcare and chiropractic care? So basically, we're just going to go through the history of chiropractic care, and yeah, let's dive in. Okay, spinal manipulation therapy or chiropractic adjustment does have a long history. Basically, back to 400 BC, Hippocrates, the father of Greek medicine, used manual treatments to treat the spine. Buddhist temples, dating back over 2,000 years, they've been doing similar traditional things such as lumbar spine manipulation. Bone setters were tradesmen and women who learned the craft to manipulate the spine, beginning in the 16th century. This is all interesting to me because I guess even through all the training that we've had, I'm not big on history. There's a lot that comes from our history. My husband loves history. It has its place and it is very important. So I'm learning along with you guys today. Pulling fun facts, doing the research for all of this has been fun and interesting. Anyways, today's chiropractic practices are attributed to Daniel David Palmer. You guys have probably heard his name before. He adjusted the spine of a deaf janitor and claimed to restore his hearing in the 1800s, 1895 to be exact. So there's a lot of history in chiropractic, which is super informative and interesting. There's more to that, I'm sure. I could have pulled many things up, but that's just the fun facts of the day that I learned. Do you need a chiropractor? This is what people ask me often. Commonly in my practice, people come to me and say, I don't like chiropractors, but I was told I need to come see you because you can help me. So it basically depends on where you're at. 85% of adults experience some form of back pain in their lifetime, and this is the most common reason people visit a chiropractor. Sports injuries are another common reason. Overuse injuries or overuse syndromes is another reason. Strains, sprains, tendonitis, stress fractures, whiplash associated with auto accidents are another good reason why people come see chiropractors. These conditions certainly can be helped with adjustments, but there is a lot more that chiropractic actually can do and chiropractors can do. So we go into a lot of these things. So preventative care. Preventative care, kind of like if you think about the way you sit at work can prevent you from having headaches, right? So a lot of us will prevent, hopefully, some migraines, tension headaches by our posturing. Chiropractic can also help prevent things from occurring, like ear infections that might be on the borderline, but they have to be more regular, right? So preventative care is not acute care and it's not chronic care. Preventative care, which most of you might commonly know as, I go into my MD and we do a preventative visit, we do a healthcare visit. That's not preventative care either. Preventative care is something that happens over time that you do to prevent an overuse injury, to prevent a subluxation or the ability to move the body, right? Such as in stretching. These are all things that help prevent our body from having an illness or from having a subluxation or from having a sprain strain, right? Runners, they stretch specific before they go running. They stretch very specific after they're done running. They're two different things. Runners out there, you know these things. It's common for people to sustain injury or misalignment during childhood and experience symptoms until years later. This is why we urge patients to come in for postural and spinal alignment assessments before pain begins. Basically, you're trying to prevent erratic movement or an abnormal movement of the body, right? So when we're younger, it's more slips and falls because your balance is off because you're growing, or maybe a kid, your brother or sister pushes you off a couch, right? So you have those kind of things. Then you go into your teens and you're into sports, so you might have more of an overuse type issue. So you want to more prevent that overuse by strengthening different things over time versus waiting until you're in your 20s when you're a pitcher and you throw and you hurt your elbow, right? So we have a lot of things in preventative care that we should be doing, but I think the loss of our definition of preventative care is kind of where we sit, right? A lot of people say, well, I am preventative, I take aspirin, and I'm preventative, I wear my seatbelt, and I'm preventative, I go in and get my exam once a year at my MD or OB, and that's good. Well, that's not preventative care. Preventative care is a goal that you set to work at, let's say, the mobility of your spine so that when you're at work 40 hours a week, that mobility and correct posture every single day that you work at it, and then maybe you stretch 5 to 15 minutes before or after work, that is more of a preventative care. So that's what I mean by coming in for chiropractic. Some people's prevention is once a month, once every other month, right? Depends on how much you do at home. If your prevention for chiropractic care is as you get older, you're not going to do anything at home. I already talked about this in my previous massage parts, but if you're not going to do as much at home, then preventative care is going to look differently. It's going to be more frequently, right? So it just depends on your goals on what preventative care looks like. That brings us into why chiropractic care and why it works. There are many techniques utilized by chiropractors, but the goal of treatment remains the same. It's to perform adjustments to the spine or other parts of the body to correct alignment problems, alleviate pain, improve function, and support the body's natural ability to heal itself. The nervous system is closely linked to spinal function. When there's misalignment, the nerve signals have trouble getting through. It's an analogy. Imagine a garden hose, right? So you step on it. What does the water do? That's kind of the concept of what a lot of my colleagues, what chiropractic is founded on. It's a holistic care, drug-free, non-invasive treatment approach that has been shown to help treat dozens of different conditions. Once the adjustment is made, the body can heal itself naturally. So I'm trained in functional neurology. There's a lot of things, and functional medicine. There's a lot of things that's going on a cellular level. There's a lot of things going on at a neurotransmitter level. There's a lot of things going on from the brain to the body. So there's the argument, does the brain control the spine, right? So a lot of people have found in scoliosis, for example, that the brain controls if the spine is going to be able to do a straight alignment, right? So the metabolic condition of our cerebellum is directly correlated to the strength and stability of our spine. But also the other way around, if we have a fully functioning brain, There is no issues with our cerebellum on the metabolic level. We get enough glucose, we get enough oxygen. Then what's obstructing our spine from sitting where it should, from aligning with its brother or sister above and below, right, each segment. When you come into an office, it's going to be different depending on what type of chiropractor you see. But during your initial visit, we typically take a health history, perform an exam, and emphasize on your spine. X-rays can be performed. Typically in my office, X-rays are performed if indicated, right? So if you come in and something says, I'm not going to adjust you today, we need to see that, then I will send you for imaging. Other chiropractors do it a little different. Once a condition is identified, adjustments can be made to different parts of the body to correct any misalignment. Several appointments may be needed to repair misalignment fully. What that means, a lot of times, patients will come in with like a chronic hip tightness. I see a lot of athletes or people who attend the gym quite frequently, and you might have a tight psoas. So it depends on how many times your body comes out of alignment that you might need to be seen to get your muscle and your bones to settle into what should be a normal alignment, but maybe what your body is not used to. So it depends on your body, again, what you're doing at home, and maybe you do need to be seen here a few more times. It's going to be different than a disc lesion, right? So let's say you were lifting something heavy like your fridge, and you heard a pop, and you go in and you get an x-ray, and you have a disc lesion at L5 and it's radiating down to your foot. You'll probably need to be seen 3 times a week for 12 weeks with a side posture adjustment. That is how long it takes the nerve to reestablish what it needs and get back in line with what the body needs. The brain to the foot, right? So the nerve only grows a millimeter to 2 millimeters. So if you catch it early, that's how much it grows a day. When you keep aligning the spine, that's what allows the nerve to stay on track, right? So it depends on what is needed there. There's different techniques depending on your health needs: heat, ice, electrical stimulation, relaxation, rehabilitation, exercise, counseling about diet, weight loss, and other lifestyle factors, and supplementation. At our clinic here, less is more. I want to find the root cause, treat it, and get you out of my office, right? I love you, but you need to leave. That is my motto here. Chiropractic care also, going back to that last slide on what to expect, chiropractic care can aggravate your symptoms. So let's say you came in and you have a low back issue, or like this guy, you might have a neck issue on your screen, and when I try to get your body to work properly, it's not used to it. Pain is an indication to the brain that something is changing. It doesn't mean it's good or bad. It just says something needs to happen there. So it sends a signal to your body to create the right cells to send to that area, and the brain did its job by saying there's an issue here. So chiropractic care can also stimulate great change. All right, how is your posture? Let's jump into that. In today's society, we spend a lot of time sitting. Sitting is the new smoking. We hear this over and over and over again, but yet, look at this guy. This is how we sit. And we do it for 40 hours a week, and then we go home and sit like that on the couch, and we lean to one side, and we put our feet up and cross our legs, and wow, I wonder why we have back pain. So I did a whole video about posture. You should watch it. I'm not going to go into this. I'm actually going to go past this. Chiropractic helps posture. Atlas adjustment. Our vertebrae, we have tons of vertebrae, right? So we go through and we go from the cervical to the thoracic to the lumbar to the sacral, right? And it attaches to the pelvis and our arms and all that good stuff. There's a lot of studies that deal with atlas-specific adjustment. There are different techniques that are different. I think it's called the Nuka chiropractic technique that just looks at the atlas. A Chicago study, I looked up a few of these. A Chicago study, 50 individuals found that following one atlas adjustment, blood pressure decreased significantly. In fact, the decrease was observed to be equal to taking 2 blood pressure drugs at once. Chiropractic care can be useful in helping people who want to avoid side effects of drug therapy for treating high blood pressure. So this is just one of the benefits. If we were to put up on the screen the spine and all of the nerves that go to each part of our body, and we talked about each one, that's sort of what we're going to be doing today. So we'll start from the top and go towards the bottom. An atlas adjustment, you don't have to be a Nuka chiropractor, but that's how they did the studies to keep it accurate so that they could actually see a cause and effect or a proper study on just one chiropractic manipulation. Anybody have sinus infections? Anybody have sinus pain, pressure? It might surprise you, might not, to hear chiropractic adjustments help with sinus symptoms. Treatment targets the bones and mucous membranes that line the cavities located in your cheekbones, in the forehead, between your eyes, and behind your nose. There are a number of techniques a chiropractor can implement when alleviating sinus discomfort, such as trigger point therapy, light force cranial manipulation, and others. So basically, cranial therapy services, chiropractic adjustments in the neck, trigger point therapy around the occipitals, even in the face and in your cranial bones, right? So we look at all that, and that reduces or prevents a lot of people from getting sinus infections over and over. So we have acute sinusitis, then we have chronic. So if you're dealing with chronic sinusitis, you need to get into your chiropractor, do some massage therapy, look at different techniques such as neti pots, heat therapies, many different things. Hearing loss, tinnitus, and vertigo. Oh my gosh, this is so prevalent in our day and age. With everything going out there right now, tons of people are dealing with tinnitus, and my heart goes out for all of you. Inner ear imbalances, such as ringing in the ears, vertigo, can also be improved by an atlas adjustment. So if you think about the bones and where the nerves go and how close the ear is to our upper cervicals, there's no need to get into the details. All of that mobility or immobility from us being on our phones, our postures, traumas, other things, right? Jaw issues, this can all be solved if you start getting your spine to move properly, to allow that nerve to innervate the ear. Basically, vertigo, we can go into, so physical therapists, chiropractors, MDs, we all deal with working on the Epley maneuver. There's a lot of times you can do this at home if you have inner ear issues. This depends on if the world is spinning or if you are spinning and what the treatment is. Let's go into the anatomy a little bit. Your head sits on the vertebra. It's called the atlas, which allows your head to perform forward and backward movements, like when nodding yes. The next vertebra is called the axis, and it allows your head to rotate to your right and to your left, like you're shaking your head. The vertebrae are 2 most freely movable vertebrae in our spine, and as a result are the ones most common and easiest to be misaligned. Misalignment of these vertebrae put pressure on the base of your brainstem, leading to accumulation of fluid in the inner ear, affecting hearing loss, ringing of the ears, and vertigo. So a lot of times children, when they have ADD, when they deal with a lot of defiant disorders, a lot of different things. It's because they have that pressure on the brainstem. Our brainstem is the connection between our brain and our body. It has a lot of different nuclei, and when it is constantly holding a pressure there, it can cause major issues to the rest of our body and major input into our brain, which our brain's job is to dampen these inputs. When it's overstimulated constantly, it has a harder time dampening them. So chiropractic adjustments help in these areas. Chronic sinusitis, hearing loss, ringing of the ear, any of this, you need to get in and see your chiropractor. Let's switch gears here now and talk about women's issues, right? So we have premenstrual discomfort. Our nerves innervate all our organs. Our nerves come out through the foramen in our spine. They go out and they innervate, right? And so if you have PMS, bloating, irritability, headaches, migraines, breast tenderness, fatigue, stress, cramping, back pain, nausea, weight gain, research from the journal Manipulative and Physiological Therapeutics include that relatively high incidence of spinal dysfunction exists in PMS sufferers compared with a comparable group of non-PMS sufferers. A lot of infertility, this is the same thing. We have innervations in our TL junction that go down and, try to, and get disrupted. What happens if you don't get what you need to your organs? They don't function properly. So we need to get that spinal location functioning. The spine communicates with the nerves, which corresponds with every other part of the body, including your reproductive organs and hormones. If there is a subluxation in the spine, it could be interfering with the communication of your nerves or hormones, making your symptoms more severe than they need to be. So women, get your butts in here. Pregnancy, having issue getting pregnant, there's a lot of research showing that subluxation can really, really interfere with this. Pregnancy is a particularly delicate time where drug intervention should be limited. For this reason, drug-free alternatives such as chiropractic care are ideal for lessening the pain and promoting your health. Maintaining a healthier pregnancy. Okay, so I have a story for you. I have 2 children, 2 healthy children, 1 boy and 1 girl. I had my girl first, and I had her in chiropractic school, where I was more active in getting adjusted. So I was getting adjusted probably 3 to 4 times a week during my second and third term in pregnancy. I was also getting acupuncture, and my birth was 9 minutes long from full dilation till my daughter was crying. I did not rip or tear, didn't need drugs or surgery, and it was a beautiful moment. Fast forward, I did not have my son until I was 7 years later. I was not getting regular chiropractic like that until towards the end, when I saw my chiropractor maybe twice a week. Did not get acupuncture and was not as active. And so when I went through my birthing and delivery, there was a lot more pain. My pelvis did not like it. I dislocated a hip. There was a few other things that goes on. Yes, age plays a factor, but I'm going to chalk that one up to regular chiropractic care from about 25 weeks on in my first pregnancy, and only from about 34, 35 weeks till I think I went 42 weeks with my second one, and there was a lot of difference there. Controlling nausea, reducing back labor, reducing time of labor, relieving pressure and pain in your neck and back, and preventing cesarean delivery. A lot of times if we get the pelvis moving and we get the baby where it needs to be, there's a technique called Webster's technique. You can find different chiropractors who are well versed in this technique to help flip babies if your baby is not head down and it needs to be, and then you can avoid a lot of these things. So definitely seek out a chiropractor who is specializing in this. We already touched on attention deficit disorder and hyperactivity. And so when we look at that, it again is just where our brainstem is being pushed on by our vertebral bodies, and that misalignment impacts the nerve and function, and restoring that actually helps and enables the signals to function more properly, alleviating that attention deficit disorder. It's not 100% effective, but it really does make a difference. You can see when kids and adults alike come in and start getting chiropractic treatment in the goal of alleviating ADD, ADHD, this really has a benefit. Again, mental disorders, so we look at our mental fitness, anxiety, depression, fear, stress, our ability to cope, all of these things. Aren't anxiety and depression and stress considered mental conditions? Yes, but they're related to our nervous system. So there's a lot of information coming out with SSRIs, and you should look that up on your own. There's a lot of things, drugs and surgery-wise, that are being proven to make the conditions of anxiety, depression, and stress worse. Chiropractic, on the other hand, helps alleviate pain by misalignments, help improve overall quality of life, which helps your mental health. Chiropractic manipulation increases brain activity, helps with the balance of the nervous system. Chiropractic care works best when there is a consistent outside care being made to the body, which includes, dun dun dun, you doing something at home, right? So like an active yoga, meditation session, prayer, whatever that is. When you're active and you use chiropractic care in tandem, that is going to change your mental state. You have asthma? Well, let's check this out. What happens in asthma, right? We have constriction, we have production of mucus, we have the closing of a whole bunch of different saccules. Several studies explore the connection between spinal manipulative therapy and improvement of asthma symptoms. Additional case studies have shown a link between chiropractic adjustments and decrease in asthma symptoms. This one's a no-brainer to me, but a lot of people maybe not, you don't know this. Chiropractic treatment involves the realignment of the spine and the nerves, which play a role in the function that the body carries out. Additionally, chiropractic care can benefit asthma sufferers by fixing musculoskeletal alignments in the rib cage and the spine. Basically, some of the issues with asthma, right? So things close, things tighten. So we work on diaphragmatic breathing instead of accessory breathing, right? So when you breathe and your chest moves up, that's accessory breathing. You're not getting the proper oxygenation into the third lobe in your lungs, right? So you have to pull that oxygen from your diaphragm down into the lower lobes of the lung and then expel it back out. With asthma patients, sometimes this gets hard, right? So you're used to breathing a certain way because you're feeling like I can't get oxygen. Things tighten, your ribs go out of joint, right? So they're not moving properly, and then you have all the muscles around the ribs that are tightening. And so chiropractic care, massage therapy can really loosen that up and change your life. Same with indigestion, right? So a lot of times people think chiropractors don't deal with this. Chiropractic misalignment and subluxation can definitely improve, when fixed, your digestion, just like your hormones, just like every other organ, right? So nerves go in and they innervate our organs. Well, digestion, it's the same thing, right? So If you suffer from chronic heartburn, diarrhea, constipation, irritable bowel syndrome, digestive problems, chiropractic can aid in restoring balance. So this is the musculoskeletal relief. There's other things that can be plaguing it, but if you think about any organ system, including our small and large intestine, these intestinal tracts are very important. They're large. They allow us to either absorb or not absorb. They allow us to breathe well or get pain when we breathe, right? So the small intestine and the large intestine deal with peristalsis. Peristalsis is a muscular contraction that pushes food and things through our bowels. If we don't have innervation to those areas via our nerves, then we're going to have less peristalsis, then we're going to have stagnation. Things are going to stay there. They're going to cramp up. They're going to cause inflammation because they're not moving, no matter if you drink or eat enough. So sometimes it is mechanical. It's not always you have leaky gut. So chiropractic care can really help in these. Diabetes, if we get into blood sugar instability, chiropractic can help with lowering blood sugar at the moment. They help to produce enzymes. So when we adjust the spine, like we were talking about innervating different organ systems, the pancreas is an organ, right? So if we have no innervation to the pancreas, right, then what happens to the production of insulin? It can go down. It can also go down if you're eating like crap and your lifestyle is really stressful and all you're consuming is caffeine all day long and not having a good breakfast and macronutrients. However, there is that mechanical component. A study done in the Journal of Vertebral Subluxation Research showed that when a chiropractic care was used as treatment for adult onset diabetes, type 2, along with nutritional and exercise guidance, the patient's glucose and blood urine levels normalized, remained stable after 1 month. Additional recent studies show that type 2 diabetes may also be linked to central nervous system dysfunction. So there's a lot going on in managing diabetes. The functional medicine component that I'm trained in, on top of the chiropractic component, is really going to be helpful in managing and reversing type 2 diabetes. All right, so look at these ladies just laughing. I love pictures of people being fun and joyful. That's my favorite. Are you smiling right now? You should be, because this is what other people say about chiropractic. It makes me feel taller. Did you know that I grew in chiropractic school? So I graduated chiropractic school when I was 30. When I went in, I was about 5'8" and a quarter. When I left, I was 5'9". This really does get your muscles and your joints, but the discs that cushion in between the vertebral bodies, when you get chiropractic adjustments, that allows for the balance and stability on that disc to be equal, to stay equal, to keep the hydration hopefully inside because it doesn't have that chronic pressure on one area of it. A chiropractor who accomplishes what my doctors do, a chiropractor accomplishes in 3 weeks what my Army doctors haven't been able to do in years. So a lot of people who are in the VA, now I'm not in system with any insurance companies. That's a whole nother discussion. You can look at another video that I'm creating or have posted already. I can't remember, did I post that? Anyways, VA doctors, I had to go and lobby that just because the law says that VA clinics have to have a chiropractor on staff doesn't mean they're implementing it. So a lot of times you won't have access as a vet into getting chiropractic care unless you get a referral. And there's a lot more chiropractors doing that. So definitely if you're a vet, go see a chiropractor. If you want to pay cash and come to me, you can. A lot of vets do. However, sometimes money is an issue. So definitely there's a lot of chiropractors who take the insurance from the VA. All right, what causes a misalignment? There are countless reasons you can have a misalignment. Some of the most common is a slip and fall, is poor posture, is joint swelling because of the damage to the bone or the intervertebral joint, inflammation from poor diet, lack of water or physiological stresses, osteoporosis, degenerative changes of the spine or the discs, trigger points, and tight back muscles that pull the vertebra out of place. This is probably 95% of all cases that come through. Some kind of inflammation, slip and fall, poor posture. We can go on and on. Chiropractic care, what I do here is a complement to other medical practices. Chiropractic care in my clinic, because I have a primary care clinic here, chiropractic care, I'd probably say is about 40 to 50% of what I do here currently. We look at metabolic health, we look at massage therapy, right? So some people respond better to soft tissue manipulation, and some people respond better to chiropractic care, and some people respond better to acupuncture, and they all do similar things in introducing a brain-body connection. However, when I work with a patient who's got musculoskeletal complaints, a lot of times the pain comes from inflammation. The inflammation comes from a poor diet or stress that's happening at work or a chronic disease pattern. So then we also work with in the root cause, hey, is it type 1 diabetes, type 2 diabetes? Do you have, Parkinson's? Do you have, what is it that you've been diagnosed with that you're coming in? Let's help support that as well. Sometimes it'll be we work with your medical doctor. Sometimes it'll be it's in-house because it's not a disease process that has progressed into needing medical services yet. A new way forward. So I hope that we have touched on a lot of different things and educated. I hope I've educated you on a lot of different things about the spine and the nerves and the brain and the body, why these things are important. As a chiropractor, my goal is to partner with you. So my goal is to make sure that you are educated and know and can identify what your goal is, how to offer chiropractic care, primary care, labs, massage therapy, and referrals appropriate for your personalized care. This landscape of healthcare right now is so different than it was 3, 4, 5 years ago. People are definitely wanting non-invasive, drug-free care, and you want that to be your responsibility. You want to know these things. You want to comb through Google. You want to get an understanding of where your body is, and that's what I do here. That's what chiropractors are trying to do all over the country and world. So I hope this was short and sweet. I haven't looked at the time, but I'm going to list some references below on the YouTube post here. So definitely, if you have questions, reach out to me, info@ptbodytherapy.com, or visit our website to get your discovery call. It's a free 15-minute discovery call to see who I am, if we could work together. I do telemedicine, I do in-house care, so if you need chiropractic, I am here in Southwest Florida, specifically Bonita Springs. Reach out, look below, see all the information that we have for you. Thank you for joining me. I hope that all this information is helpful and accessible to you. Please feel free, again, reach out. If you have interest in disease prevention, showing progression of a disease, or alleviating your symptoms, I am here and I can help you. Thank you so much. And I will quit talking now so you don't have to hear my voice anymore. Thanks for listening and have a very wonderful day.